What President Obama said about how coronavirus is affecting the black community. Hear that next. Data showing African Americans are being hit disproportionately hard by coronavirus. In Chicago, black Americans make up about a third of the city's population, but account for 72% of coronavirus deaths there. Let's bring in Dr. Suzet McKinney, CEO and Executive Director of Illinois Medical District. Thank you for joining us. I appreciate it. Dr. McKinney, former President Obama recently held a call with faith leaders across the country, and he talks about African Americans being more vulnerable to coronavirus. Listen to this.
The data is starting to show that because of existing disparities in health that arise out of our history and arise out of our inequalities and the fact that we don't have the kinds of health care for all people that we should, despite the efforts that my administration made and the progress we made with the Affordable Care Act, that African American families are more vulnerable to this disease. And we're going to have to make sure that we do that there are specific strategies to address the vulnerabilities of those communities, and that services are appropriately allocated in your cities and in your communities for that.
In what ways are African Americans more vulnerable, and what steps need to be taken?
Well, Don, first of all, thank you for having me. I think one of the primary reasons why African Americans are more vulnerable, number one, is because our communities suffer from healthcare disparities much more often than other communities. So when you see a lot of chronic health conditions, such as diabetes, heart disease, and hypertension, and then you overlay COVID-19 on top of that, it creates much more serious illness. And that's why we're seeing a lot of these disparities.
And what steps do you think need to be taken to fix that?
Well, I think there are many steps that need to be taken, and I think that there's a lot that we are seeing in our communities. So first and foremost, a lot of these issues, these challenges around healthcare disparities have to do with systemic problems that we've been seeing for many, many years. Mm-hmm. The large healthcare disparity in the African American community is not new. However, for COVID-19, we need to be increasing the testing so that we can identify where larger pockets of illness are existing, and we need to be getting treatment to those people who are suffering greatly.
So, you know, he talks about it, I don't want to play it, but he talks about folks wanting to congregate, as a society. Do you find there's skepticism among, in communities you serve when it comes to that? About sheltering in place?
Yes, I do. One of the things that is apparent to me as a public health official is that this COVID-19 pandemic is the worst pandemic that our country has seen since 1918. So that means a large segment of our population don't understand it. They weren't around in 1918 when that major pandemic occurred, and they really just don't believe that sheltering in place and social distancing are effective. Okay, but if there were one message that I wanted to get out to the community, it would be that in the absence of a medical treatment, such as a vaccine or an antiviral medication, it is these social distancing measures that are our key tool in our efforts to combat this pandemic.
Doctor, thank you so much. I appreciate your time.